Wait till, okay, go.
Hi, good night to all. I want to introduce myself, Ignacio, Ana, and Jetzabeth. And we are working for the Angels Award, which is an agency that is providing services to homeless families here in the county. So I'm gonna pass it out, the flyers, and if you're interested, you can get the information and you can contact us. So our main target is our homeless families living here in Orange County, and we see statistics show that since 1980 or probably before that every time there is a recession, there's more jobs that are being losing. So that means that there are more people out of the workforce, more people suffering for financially speaking, but also more families too as well. That most of them, between like paying for the rent or getting other expenses like food and meals for the children, they prefer sometimes to look for shelter or living in the street. So we can see right here, like for instance, 1980, we see that the problem we have recession that it went down, and from 1980 to 90, we never recuperated that. But then from 1990 to 2000, we see this big gap, and right here we see it we get down to as well, and then it went down. So this is a trend that we are, looking at how, these problems, losing the jobs or the economic, situations of the country is affecting, the families. So far, according to the U.S. Department of Housing and Urban Development, there are 3.5 million Americans are homeless at some point in their lifetime here in the USA. So far, it's like, according to the report, there were 367,000 families looking for shelter from January 2008 to October 2010. So it's according to the U.S. Department of Housing and Urban Development. Also, we see that in 2009 there were so far 1.57 millions of people looking for shelter. Also every night. So this is so far the statistic that we have. Here in Orange County, we see that 45,000 individuals and persons in families become homeless in Orange County each given year. So it's a big problem with families that we see. 38% of homeless people in Orange County are women. 17% of homeless women have children. So it's according to the Orange County homeless census in 2009. So it's back like 3 or 4 years ago. So we want to develop, an outreach program that can help, families in providing, housing, providing education, and providing mental health, physical and mental health, services. So it's going to be, to the reaching out workshop and services that we will provide for a year. So far, the length is a year for June 2012 to June 2013. And our main, goal is to reduce the number of families living in the street by providing, housing programs, but also, by improving the mental and physical health, and by decreasing the illiteracy among homeless children. That many of these families have children, and they don't really know the system, or they don't really understand the system, or they don't have the help they need to get those children back to school. But also, they don't. Sometimes many of them, they don't know the services that community is offering for them to get the mental and physical assistance that they need to get well and continue improving their lifestyle. So far, the setting that we see that percentage of homeless families living with children, 39% of the families have one child, 36% have 2 children, and 25% have 3 or more children. So we see that this kind of population is in a big need, of services. And that's why our agency wants to provide those services. and I'm not going to talk about that.
I'll be talking about the program input. The Angels at Work outreach specialists will go out to the community and inform the homeless about the services that are provided to them once they join the shelter. And services are as followed. Once the homeless arrive to the shelter, OC housing personnel will come to the shelter to provide them with information about affordable housing, programs such as how and where to apply, requirements, and what to expect during the process of obtaining affordable housing. Social service agents will come to the shelter and offer their homeless services such as food stamps, cash assistance, veteran assistance, and WEEP. They will also help them on how and where to apply and where they can find these services close to their shelter. Specialized physicians, psychologists, pediatricians, therapists, and nurses will come to the shelter and conduct mental and physical exams. These exams will be done once the homeless arrive to the shelter and will continue on throughout their stay as needed, as well as a once-a-month evaluation to see how they are doing. Teachers and counselors will also come to the shelter to once a month to update the parents about the child's progress. And tutors will provide after-school tutoring services Monday through Friday as long as the children are in school. The expected outcomes. We hope to help 75 families. And there are 3 variables that we will be measuring. There is the housing, which will be measured by surveys and questionnaires to find more about their housing status. Mental and physical health, which will be measured differently depending on clients' age. For adults, there's a global assessment of functioning, the Beck Depression Inventory, and the SF-12. The SF-12 is a simple 12-item survey. This survey provides a glimpse into mental and physical functioning and overall health-related quality of life. Going around would be an example of what the SF-12 looks like and what the questions would be. And for children, it's completely different. There is the BESS, which stands for Behavioral and Emotional Screening System, and the SAQSE, which stands for Ages and Stages, Social Emotional. These tests will definitely show us how our clients are doing overall. And literacy will be measured by WRAT, which is a wide range achievement test, which measures an individual's ability to read, write, comprehend sentences, math problems, as well as teacher surveys to see how the young ones are doing in school. And percentage of improvement expected of the clients, 83%. Oh, I'm sorry, I skipped it. Percent of clients expected to show improvement. 75% of families will be relocated to a housing facility. 90% of families will be receiving mental and physical health care services. And 80 to 85% of children will learn how to read and write long and short sentences, which will be measured by the RAT test. And how did you measure the outcome? We will be having pre and post testing, global assessment of functioning, teacher professor surveys, and the RAT tests. Measurement instruments. We will have the pre and post testing and surveys which will be for both the children and adults. The WRAT and BES. The WRAT is appropriate for all ages, 5 and up, and the BES is more appropriate for children 5 years and under. Clinical evaluations will be used to measure the client's progress and current mental and physical health as recorded by specialized physicians, therapists, and/or pediatricians, and the school attendance, as well as grades, report cards, parent-teacher conference, surveys, questionnaires will be used to measure the improvement in literacy.
With the data analysis, we'll be analyzing the age, gender, and ethnicity level of education, physical, and mental health. The employment will be based on how much or how low they used to earn when they still had a job. And based on this will be, certain families vary on how long they have been homeless, and the pre and post test will let us know how long they have been homeless, as well as the testing we will be using will also tell us their stage of mental and physical well-being. And a pre and post test will be given to see how much they know about the services that they will be giving in our center. The evaluation design and rationale will be a timeline series, and we will be given it each 4 months. And each 4 months we'll see how much they have improved based on the last 4 months. And some of the validity threats would be attrition, maturation, depression, anxiety, substance abuse, history of homelessness, nutrition, income, and education. And based on the income will be same as before, families not making enough money or no money at all, or low income. Education, parents not finishing school or not taking school seriously, taking the kids out of school. Pre and post will be based on family, testing to see the overall improvement, to get real answers. The data that we need in order to help them. Experiments, we wouldn't get real answers, which is be biased. And then these are the hypothetical findings that we have. And then for housing, in June, that's how much they knew about housing before. It was up to 0. And then in September, it went up to a 2.9 based on how much they learned. And in January, it went a little bit more up to a 3.5. And by the end, in May, they learned up to like a 4.8. That's their understanding of how to get housing, how to apply for housing. And then for their mental and physical awareness, how much they knew on how much physical or mental. When it started out as a 0.5. They didn't really know that much. And in September, they knew like about a 2.3. And in January, it went up to a 3.7. And in May, they learned up to about a 4. They knew enough to get by. And for literacy, meaning like school for children, how to learn and read and write. When they first started in at our shelter, they knew like about 1.3. And in September, they knew a little bit more, about a 2.8. January, about a 4.3. And in May, it was about a 5, which they learned. And obviously, these numbers will be measured by RAD, pre-testing and post-testing and surveys based on the 4 months for each 4 months. And then the recommendations will be working with other agencies, community involvement, making the homeless population more aware of shelters and services, multicultural training. Other agencies would be like medical clinics, working with city recreational parks and centers. Some community involvement would be Catholic workers, churches, and social services. Awareness would be homeless who are already in the system, going out into the community and telling other homeless how they know, what they know about it, and about the services that we serve. Multicultural will provide staff to train them how to talk in bilingual, how to be bilingual or other languages. And